Hello, and thank you for tuning in for another episode of Parenting Pickup. I'm Kara Johnson-Bader, your host. This month, we are excited to have Kelly Lemieux. Kelly has been voted by Minneapolis-St magazine as one of the top doctors in the Twin Cities, has been a board-certified pediatrician for 29 years, and is the pediatric medical director at Ridgeview Medical Center. Before we start today, we'd like to clarify that we won't discuss Ridgeview's medical operations. We do not have a financial relationship with Ridgeview Medical Center, and Kelly's views expressed in this episode are her own and do not reflect the official position of Ridgeview Medical Center. Kelly is with us in the studio today to give us some incisive updates on trends in pediatrics in 2024. Welcome, Kelly.
Thank you for having me.
We're so excited to have you here today. I know a lot of families are curious about the state of children's health care and how they can best ensure their child's long-term well-being. And I thought we could just begin by having you tell us a little bit about your background.
Thank you. Yes, I have been a pediatrician for the past 29 years, and it is a dream job. I have worked in the community as a primary care pediatrician and have now more recently taken this role as the pediatric medical director at Ridgeview Medical Center.
You have a lot of experience, and there's so much to talk about, Kelly. So when it comes to children's health, I think I'm just going to dive right in. And so here's kind of the first question I have for you is really transitioning to a new childcare can be challenging for both children and parents. And as a board-certified pediatrician, what tips do you have to help create a smooth transition for both parents and children?
Great question, and I relate to it as a parent as well, even though it was a long time ago. But sending your baby or child to daycare is a big step for both the parents and the kids. The transition can be emotional, and some families handle this change with a lot of ease, but more often and most of the time, a little preparation can help make things go much more smoothly. So I always tell parents in the weeks before daycare starts, if it's an option, visit the daycare a few times if possible. Talk with the daycare providers about the common routines that your baby or child will follow and learn how they help babies and kids adjust to the new daycare. If possible, and sometimes parents have the flexibility, start daycare with shorter days. Don't dive into those long days right away. And then practice getting your baby or child ready for daycare. Practice those routines that you're hearing they're going to be asked to follow. Some real common examples that can be helpful is make sure your baby can take a bottle prior to starting daycare. Try to transition them to a consistent feeding schedule before you go back to work and not at the time that you're going back to work and making that transition. Some babies have a challenging time taking a bottle when there's a lot of activity or noise around them that they're just not used to. So even practicing feeding them in some of these same environments can be helpful and make that transition less stressful. And lastly, try to make sure your baby has transitioned their sleep to a crib. Most states require that babies sleep in a crib and on their back to reduce the risk of SIDS. And that's our recommendation as pediatricians too, and the official policy statement of the American Academy of Pediatrics. The best way to help a baby accept sleeping in a crib is to practice it, and practice it at each of those sleep times. And lastly, just to help the emotional side of that separation and that transition is know that there's good evidence and science to support that babies who are in high-quality daycare environments can actually benefit with their development and cognitively and have better school readiness. So you're doing good things for your kids.
I think that's all incredibly helpful advice, and I can reflect back to when my oldest, Ben, went to childcare, and it was the hardest thing I ever did.
Absolutely.
But those tips are so helpful of just preparing ahead of time.
Yep, absolutely.
And I think the more preparation you do, the greater success you'll have for sure.
Yep, everybody feels better.
Absolutely.
More confident.
Another question is we've kind of noticed more earmuffs and headphones around, and research is showing that children can benefit from more protection from ambient sounds. Can you tell us about what you've learned about children's hearing, kind of noise pollution, overstimulation, and some of the long-term consequences involved with not protecting your children's ears?
Great question. And really, it gives me the opportunity to share one of the more recent policy statements that's come out of our governing body, which is the American Academy of Pediatrics. And in November of 2023, there was a published policy based on some work that some pediatricians had done around this issue. And for sure, environmental noise, even something like traffic noise, can affect learning. It can affect physical well-being, sleep schedules. And children really have unique vulnerabilities because children have to rely on adults to remove them from noisy situations since they may not recognize that they're having any kind of hazardous noise exposure. One example of environmental noise that can affect infants in particular is sleep machines or white noise that we frequently use. And they produce a sound in the location where babies sleep to soothe babies and mask other noises. There have been several studies that have shown potential benefits, helping babies fall asleep easier and decrease crying time. But one study has raised concerns that the sound level, especially of machines combined, and in this study they looked at using 3 machines at a time, that it would exceed the occupational limits of that hearing damage could do, and especially if it was played for a prolonged period of time. So our best advice is if infant sleep machines are used, it's probably safer to locate them as far away as possible from infants and to set the volumes as low as possible in order to help also limit the duration of use. Background noise exposure is another environmental exposure that can occur, and sometimes we just don't think about the noises that we have on in the background when kids are playing. They may not even be paying attention to the noise that's on. So for example, when we have a TV on in the background and a child is otherwise occupied with another activity, it would be good to just turn it off and pay attention to reducing that background noise. And listening to music is important, but as our educational tools have evolved, we know that kids are using personal listening devices in more and more frequency for learning too. And we know that exposure to this, especially at high volumes, can result in hearing loss or tinnitus, which is ringing in your ear that can become a chronic problem. When kids are using personal listening devices, they should be able to hear when they're spoken to. And that is just a common sense level that we don't have to measure decibels, but we can check in with our kids and make sure they're hearing us speak when they have their personal listening devices in hand. Other advice that I could give to caregivers of young children would be avoid excessively noisy venues like concerts, sporting events, fireworks displays. Use hearing protection such as protective earmuffs. It's amazing how well they can tolerate them if they need to be in those noisy environments. You can use earplugs, but we get a little nervous about earplugs. They need to be properly inserted, and they can be a choking hazard in really young kids. And then reduce noise spaces as much as you can, both at home, in childcare settings, and educational settings, which is a challenge when you have a group of kids together, as we all know.
Absolutely. And I think what stood out to me is knowing that if you talk to a child who's wearing kind of headphones, that they should be able to hear you. And if they can't, that's a sign for us as parents to tune in and help them turn down the volume so they can hear, so they're not damaging their
Absolutely.
ears.
And then having up-to-date child visits with your pediatric provider. We should be routinely screening kids' hearing at those well visits. And if you have particular concerns about the exposure to noise that your child has had, make sure you raise that as a question or a concern to your provider.
I also liked turning off the television in the background. It's just unnecessary noise, and it's better to just listen to your child play and let them play and engage in that conversation with them as they're playing.
Absolutely.
Another topic I'd like to move into is what advice do you have for families when looking for credible resources to guide decisions about their children's health? I feel like you can kind of Google things and find a billion different resources all saying different things. So what would you recommend as a pediatrician?
That is such a great question. And I really As a current parent of adult children, I really feel for parents of current young children, because when my kids were growing up, we couldn't Google. And I think Google has created an environment where parents feel like they need to find answers on the internet. And parents understandably want to help their kids, and they do Google search for symptoms, especially when their child is having symptoms of illnesses or just other general parenting concerns. There's an abundance of both good and bad information available on the internet that can help guide parenting decisions. So in general, what I recommend to parents is know who sponsors the site that you're reading your information on. If the website does not disclose who sponsors the site, ignore it. Look at the credentials of the people who are informing on the topic. Are they credentialed as medical professionals when they're giving medical advice? Check the date of when the information was first published. We all know that science and evidence evolves, and information and guidelines need to be updated. And then look for factual information. Ask. And finally, my biggest piece of advice would be to ask your primary care provider that takes care of your child for recommendations of good resources for medical information. Show them any information that you may have found, especially if it doesn't make sense for your child or contradicts the advice that you're getting from your medical providers. Many clinics and the places where you take your child for medical care have guidance and their own links and websites to guide parents to get mainstream, good evidence-based scientific information when they're looking for answers on the internet.
I think that is really helpful for families because there's so much out there, and to think about what are the credentials of the individual who wrote the article or has a website versus just taking the first article that pops up. And I like starting with your primary care because there's always great information on websites.
Yes.
As parents, we never want our children to be sick, but of course it happens. So what trends are you seeing regarding children's health, and what guidance would you share to parents on how to prevent illnesses, and what should they do if their child gets sick?
It's a great summertime question. Pediatricians love summertime because generally we give kids a break from a lot of the illnesses that usually circulate during the winter months, and we think of it more as a wellness season. But we do also have summer viruses pop up that are affecting kids, and we're definitely seeing a little bit of that trend right now in our community. So one of the summertime viruses that has had a recent uptick is one we call enterovirus, and parents know it more commonly as the dreaded hand, foot, and mouth disease. And what hand, foot, and mouth disease is a common viral infection that causes painful red blisters in the mouth and throat of kids primarily, but it can also affect their hands and feet, thus the hand, foot, and mouth disease. And then in our infants can also cause painful red bumps in the diaper area. It's contagious. It spreads easily through contact. So unwashed hands, changing diapers and not washing hands, saliva, runny noses, coughs, sneezes, and the fluid from the blisters can actually be contagious too. We mostly see it in kids under the age of 7, and outbreaks are common in daycare settings and in school settings. There aren't medications that we can give kids that can help change the course of the illness, and there's not a vaccine to prevent it. But there are things we can do to make kids more comfortable while they're ill and help them not be so contagious and spread those germs to other kids in daycare and school settings. So for sure, we want parents to know, keep your kids comfortable. Give them Tylenol and ibuprofen and recommended doses and the recommended intervals that are on the bottle. I always tell parents, if you were experiencing the bumps that your child has right now in your throat, you would be taking ibuprofen every 6 hours, and it's okay to give your kids medicines to keep them comfortable. And we want to keep them comfortable because with those sore throats, dehydration becomes a problem for some kids. And so in addition to the pain management, offering them cold foods like ice cream, smoothies, popsicles, both to keep them hydrated and to help keep them comfortable. Kids with blisters on their hands and feet we should try to keep those areas clean and uncovered and dry so that they can heal. And then call your primary care clinic if your child is getting more, and rather than getting better over a course of 3 to 5 days, is becoming more irritable, can't be comforted with the routine comfort cares, seems like they are getting more sluggish or lethargic, or if you're worried at all that they're dehydrated. And in general, kids shouldn't go back to daycare or school settings until they have been without a fever for 24 hours and those blisters are no longer weeping and open.
Thank you for sharing that. I think that's really helpful. We'll take a pause right now for a word from our sponsor.
At New Horizon Academy, we know that you want the best for your child, and so do we. As a family-owned childcare provider that has been serving families like yours for more than 50 years, we are proud to provide best-in-class care and education for infants, toddlers, preschoolers, and school-age children. Through research-based curriculum, social-emotional learning, physical movement, and nurturing care, we'll help your child prepare for kindergarten and beyond. Visit the New Horizon Academy website to learn more and schedule a tour today.
Kelly, you've shared a lot of wonderful information with our listeners, and I appreciate that. We're at the point in the podcast where we take parent questions, and so I'm going to jump right in. And our first question comes from Terrence, and Terrence says, as a parent, I tend to be an overthinker. When my daughter gets sick, I'm not sure if I should take her to urgent care, the emergency room, or simply go to our pediatrician. Are there any guidelines or suggestions you might have for more anxious parents like me?
Well, I would first of all tell Terrence that you are in really good company. And even as a pediatrician, as a parent, I was often an overthinker, and I am relating very much to your question. But a wonderful place to start in answering that is to never forget that you can always call your pediatric provider or your primary care clinic. Many practices offer after-hours triage nurses that are available 24/7, and they can help you decide whether your child's symptoms warrant a trip to the pediatrician or an immediate care facility like an urgent care or urgency center or an emergency room. One thing to remember is when you place a call to your primary care clinic and the on-call nurse or provider returns your call, it's always helpful if you can describe your concerns and how your child looks to that person. Are they playful and active, or are they hard to wake up? Are they having difficulty breathing? And any pertinent background on your child's past medical history and any medications that they're taking. If you're calling because your child is sick, you can take a temperature and also provide that information. And these pieces of information really help the on-call provider recommend one of the following options. So often we'll recommend, based on the symptoms, we're able to reassure you and say watchful waiting or waiting till morning to go into your pediatric provider is absolutely fine. And the nurse or provider can also recommend some home treatments to keep your child comfortable during that time. We can recommend an appointment in the pediatric office, or we might recommend that you do visit an urgent care or emergency room based on your child's symptoms. In general, when thinking about going to an emergency room, there are some really specific things that we will immediately refer your child to an emergency room. One is newborns. So babies who are under 4 to 6 weeks of age and have a fever of over 100.4 need to be seen in the emergency room at the time of their fever. If kids have severe chest pain or trouble breathing, if they're having fainting symptoms, or they're coughing to the point that they're coughing up blood, we're going to say you need to go to the emergency room. Kids with asthma having severe asthma attacks, any kids that are having dehydration symptoms, allergic reactions, and injuries that are large or complex that involve cuts or bleeding, we're going to say you need to go to the emergency room. And then lastly, we talk about neurological changes. So if kids are just acting unusually confused, lethargic, you can't wake them up, or they're having seizures, we need you to be seen in the ED.
I think that's incredibly helpful. I know as a parent, I too am an overthinker, and often use the triage nurse and call line to help me make wise decisions. And sometimes I would go into that panic mode, like, we need to pack up and go now. And then it would be stop, make the phone call and talk with someone who is knowledgeable and can give advice that will help me make the best decision for my children.
They are an amazing resource, and I would really encourage parents to use it.
I echo that. That as a parent, it came in incredibly helpful to me. Our second question is from Jackie, and Jackie says, my 2-year-old Graham is all over the place, super energetic, has trouble focusing during late night story time. How do I go about figuring out whether something like ADHD is a possibility or is it something else?
Another great question. And we get this question as pediatricians often from parents and family members about kids. And the challenging part of the answer with regard to making a diagnosis of ADHD is that many of the core symptoms that we use in order to make the diagnosis are also very normal and expected stages of development for kids, especially in preschool and early school age children. I don't know a 2-year-old who doesn't have some of the core symptoms, which include inattention or not being able to focus on listening or paying attention over a long period of time, and impulsivity, which is basically acting before you're thinking. We've just defined a 2 and a 3-year-old right there. But taking it a step further, the biggest differentiating factor between ADHD and normal development is impaired age-appropriate functioning. So in other words, are the symptoms that this child is having interfering with their ability to function in a happy and healthy way with peers of the same age in a social setting like daycare or preschool? And if the answer is they are like their other peers and they are happy and social and functioning, we would not make those symptoms be abnormal. They are likely just a part of that child's normal development. Generally speaking, pediatricians won't evaluate children under the age of 4 for a formal ADHD evaluation because really up until that age, most of the core symptoms are just an expected normal part of development. But if kids are having symptoms of inattention, hyperactivity, or impulsivity at that age, and they're associated with poor school performance or difficulty or making or keeping friends, then it's time to talk to your pediatric provider and see what next steps might look like. In talking with your primary care provider, they will be able to discuss the options for what we call a more comprehensive or thorough medical and psychological evaluation. ADHD is really a diagnosis that we make on symptoms. There isn't a specific test that we can do, like a strep test or an X-ray that's going to diagnose kids with these symptoms. So many times the symptoms of ADHD can actually indicate other developmental problems, including symptoms of poor sleep. So that's one of the first questions we'll ask kids. How are your kids sleeping at night? Are they getting adequate hours of sleep? Because a sleep-deprived child can look inattentive and impulsive as well. Anxiety is often a big crossover symptom. So kids who are constantly living in a state of anxiety are working so hard at calming those fears or those anxieties that they really don't have the ability to focus and concentrate, and again are going to look impulsive. Other things that can masquerade as ADHD, including learning processing differences and challenges just with social skills. So it's really important to cast that net wide and not automatically land on a diagnosis of ADHD when you have symptoms of inattentiveness and impulsivity, and especially in a child under the age of 4.
That, I think, is incredibly helpful advice because as parents, I think we often jump to question ones about being overthinking and worrying. And so it's nice to get that reminder that it is normal for a child who's 2 to be inattentive and have lots of energy and not listen, and that it really is helpful to talk to your primary caregiver who can help you sort through all of that and help you determine what is developmentally appropriate and normal for a child of that age, and when is it time to look more deeply into something.
Yes, exactly.
Well, our third and final question comes from Rosa. And Rosa says, our daughter was conceived in May of 2020 in the middle of COVID lockdowns. Is there any research or information about the impact that COVID may have on children's health and development in the long term? I've read a ton of conflicting information online, and I don't know how this might affect my little one.
COVID-19 and the pandemic obviously created a tremendous amount of stress for everyone, but especially for families with young children. Families experienced heightened amounts of physical, psychological, emotional, and financial stress throughout this time. And we know that infants and children who live with stress have the potential for delayed developmental milestones, including difficulty with emotional regulation and social and behavioral issues. But some of the results of the more recent studies have been more reassuring. More recently, there was a study out of Ireland that used standardized tools to measure developmental milestones, and were especially reassuring, showing only a slight difference in developmental scores between infants and toddlers who were tested pre-pandemic versus those who were tested post-pandemic. We definitely need more studies, and this is worthwhile looking into. But in the meantime, and from a pragmatic and practical standpoint, continue to be a good advocate for your child. Families know their kids best, and they should be encouraged to make certain that their baby or child is seen for routine well child visits with their primary care provider, because these visits are a wonderful opportunity to evaluate developmental milestones and to get extra help for kids if they're experiencing developmental delays. It's important for families to focus on the promotion of language and communication skills, especially since kids lived in such an isolated environment during the pandemic. Parent-child engagement and just that one-on-one play, nurturing relationships, opportunities for free play and exploration, and then support to caregivers for the stress that they've lived through too, so that families overall can reduce that level of stress and continue to be good supports for their children.
That's incredible. Kelly, thank you so much for joining us on the Parenting Pickup podcast. The information I think is critical for families to know. And with all these helpful resources, if families can utilize even some of these methods, I think they'll find them incredibly helpful. So thank you for your time today. I really appreciate it.
Thank you for the opportunity.
If you would like more information on this episode or need access to the other resources mentioned, head to our website at newhorizonacademy.net. And if you have any questions, please email us at parentingpickup@nhacademy.net. Thanks, and have a great day.